Okay, my name is Dr. Ifeanyi Sofo, and I'm the CEO of EpiAFRIC, a public health consulting firm based in Abuja. We're the ones organizing the hackathon in partnership with Digital Health Nigeria, Nigeria Health Watch, which is our non-profit arm, as well as CC Hub. And this event is supported by Facebook.
The reason we set up EpiAFRIC really was to try and bring the global experience that I and my colleagues and partners have had working in public health in different parts of the world, and combining that with our local knowledge of Nigeria and the specific challenges that Nigeria faces, and seeing how we can blend that to provide support to the Nigerian health sector in terms of consulting, high quality consulting work, in terms of communications, in terms of organizing conferences and workshops like this one.
Okay, so basically this hackathon is actually really exciting for us as a firm because it's an opportunity to bring together two very divergent communities, the health and the tech communities.
Growing up now, becoming a doctor and having an idea of what technology has done in other sectors, I feel that the time has come for the health sector to make use of the benefit of technology.
So what we've done before now even is to advertise for ideas within the health and tech communities to say, okay, what do you consider as the top health issues in Nigeria, and what solutions do you think can be provided for them? Before now, we've collated all these ideas. So what we're going to do today is that we're going to start with panel discussions made up of very senior medical professionals as well as other business people.
So today we expect, what you should be expecting really from the panel, at least from me, is really picking on those practical things, everyday things that we do, that we know can be done in better ways, but we're probably not doing that. Or some that we already have some technology solutions to, but perhaps we don't think that they're optimal. The truth is that the more we have these conversations, the more, we're open about the challenges.
In ex-local government, there was far more malaria than in Y. What we do is we just gauge it and then we throw commodities at them. Well, now we know whether these people need 6,000, these people need 600. So we weren't doing this last minute, it's about to expire, take them to Abuja, we'll begin to redistribute. That was a real problem. If we took this to the X thousand local governments in Nigeria, 100, 700 local governments, and we deploy this across, we would for the first time have a malaria map. That's technology.
Another challenge I would just like to also highlight is the issue of medical fraud. And it's a dirty word too. Nobody likes to think that there is that, but it happens. And it happens on all sides. It happens from the patient side. It happens also, unfortunately, also from the hospital side. And right now, we're unable to really capture all of that.
One of the things I found out with the health and tech is that the techie guys, they come, they provide some sort of solution, and then they walk away. No. Proper collabo. You're sharing risk. You're sharing everything. You're sharing profits, whatever. You're in it together.
We have a project at the moment where we're equipping the colleagues working at the land borders with mobile phones, with apps that we can use.
So I always say, why reinvent the wheel? You can tweak the wheel to make it work for your kind of road. But hey, if you know that it's already working somewhere else, adopt it already. There must be a reason why that's happening there.
So after the panel discussions, we would have guidelines about the hackathon. Afterwards, we're going to form teams of about 10 different teams, 6 people per team. Then they will now go into their different teams and begin to develop ideas.
For those of you that will be in this hackathon, I want you to really understand and really think of it in the sense that you also have to think beyond your applications. We believe in solutions that software and hardware. So we're not just giving software, which here in Nigeria, they still find that you haven't left something behind. You almost have to have a hardware attached to it for them to really feel like you've delivered something to them.
So what we've done is that we have created 5 different themes, THE, that encompass all those different 60 themes that we started with. The 5 different themes that we have access to healthcare, we have health literacy, medical education, pharmaceuticals, and healthcare financing. Those are the 5 themes.
So over the next 48 hours, the teams are expected to design a platform. Whether you want to use a web technology, mobile, SMS, you want to build a chatbot on Facebook, like think of a solution that is useful, and think of the appropriate, medium to get it into the hands of users. Okay, so the goal again is to build a functional prototype. We don't expect that all the 20 and 22 features that you want on the product should work. We want it to do one thing and do one thing incredibly well. That is what you're going to be judged on. It's always nice to have lofty goals of what you want to do, but by come Sunday evening, it's important that whatever you show the judges on the stage is something that either they can whip out their computers and use, or they can whip out their mobile phones and use, or you can demo and give them maybe a URL, a link to a website where they can use and use it immediately.
Whatever ideas we're going to work on here today must be formed here today, not, do you understand? Because if we don't do it that way, if you've been working on your ideas for the past 3 years, then people who just come up with an idea today are at a disadvantage.
The group that sees the product development, how would you convene this team? Are they here?
So that's a tricky question. One, the team that will see the product to Sunday are in this room, and more people will join in tomorrow, right? So seeing the product if you build a product that works and can go to market by Sunday, it's brilliant. That's the team that saw it to market. Yeah? In our experience, it doesn't happen.
I mean, one of the things that I find interesting about this is technology has become such a part of our lives, and I think it's particularly important to make it accessible, right? So that the technological solutions to problems, but sometimes they can be out of the reach of, the ordinary people, and I think it's so important. And what I like about this is that it's being done here, that we're bringing local knowledge together, and it's very exciting.
If you're interested in working on the thematic area, access to healthcare, please just go there. If you're interested in health and literacy, can you join me here? Health and literacy.
So we formed the team based on some healthcare professionals, developers, business developers, marketers in each team. And we have 5 teams based on different themes in healthcare. So like access to healthcare, medical education, financing, and some other 2 ones. And my team is on access to healthcare. Yeah, so we're working for a solution that can improve access to healthcare, improve the quality of healthcare services in Nigeria. But for now, we're focusing on Lagos State.
Yeah, so today what I'm really going to be looking at is how much thought a lot of the health tech people here have really put into understanding the end users that are going to be using their system. And so I really think that it's important that we remember in healthcare, we're developing technology for humans and not for tech. And so really understanding their needs, their workflow, what they consider value is something that I'm going to be looking at with the participants in the hackathon today.
I'm here really as a guest to listen to ideas, to see whether I can hear any interesting ideas, and potentially be an adopter, early adopter of one of the ideas that may come out of this hackathon.
We just came together and we identified what each person does, where their strengths lie, and then we are trying to talk about the solutions we want to create.
At the end of the session, we hope to have promptly tackled at least a particular problem in the health sector that will have a wider reach in proving that Nigeria can actually get things right ourselves.
Healthcare information is what the world has moved into, where every patient has identifiable records that help the healthcare professional in determining the cost of treatment for it. In other places, that information is portable. What do I mean by that? The information can move with the patient wherever he's seeking care.
I think the real focus is how do you actually get things into a hospital, into a general practice, into a radiology facility, into a lab. And those are challenging because a lot of, especially young guys, don't know those problems really well. If you haven't spent 10 years in a radiology center or worked with radiology, you don't actually understand the day-to-day problems in a radiology center, right? Same thing with a lab, same thing with a clinical practice. Whereas like everyone knows the patient experience, everyone has been sick.
Well, I'm hoping that we have people. We're going to have people that are going to come up with ideas that are going to incorporate technology into the healthcare sector to give better healthcare delivery.
So we're looking at this from the perspective of the process, especially in health financing, as it has to deal with health insurance. We're looking at the process from the individual to the health insurance service providers, which is NHIs and HMOs. So we're looking at the problems that exist presently in Nigeria. And one of the major problems we have is that the health insurance coverage is not expanding.
But ultimately, the real challenge is about how do you link the different centers together? How do you give people access to care? And that's a problem we don't see solved as well in hackathons.
So we have a very brilliant team. They are very interactive. We've been working together. We have developers, designers, cartoonists, and the health specialists all working together to make our dream or our app come true.
This group now is bringing ideas. We are still trying to brainstorm the best idea that will hack and develop a mobile or web platform.
At first, as any group is, for those who understand group dynamics, any group work always comes with its own little challenges here and there. But with maturity and with wisdom, we've been able to overcome all that. And I can say, as at this time, we have a consensus idea and focus on which we want to run with.
We're coming up with great ideas, and I think we have a good team spirit going on. So.
Okay, because the pitch will be ending, it will be up in a few hours. We are well timed and we're taking it from there. So we should be done. We should be ready. We're very hopeful that will be very successful.
The product is looking good. We're almost done with the web design. Our USSD model, which can't be done within these 48 hours, but we have a demo which is working and has been tested now. So I believe in the next few hours we'll be able to show our stuff.
For my group, people didn't want to come around to health insurance because it was a little bit technical. You needed to have a very, very good understanding of the subject matter to be able to profile solutions. You can't profile solutions to what you don't understand, the problems you don't see. So at the beginning it was small, but later we had new people that came in and joined us. So it was very, very fantastic. I realized that there are a lot of people who know more than I do. And at times, when you think you know something, you need to keep silent and listen. That's the best way to learn. And I've learned from everybody, from the programmers, the doctors, the UI designers, and everybody.
So we have 5 different teams who have spent the last 48 hours trying to hack out solutions for the different challenges that have been pointed out. And for the next, 30, 40 minutes, we're going to be hearing from the different teams. And of course, they are going to be asked questions from the judges. As a reminder, the first prize for the winning team is 1.2 million. Second prize is ₦1 million. The third prize is 800K.
And we are encouraged by what we're seeing. We're encouraged by the passion, the intelligence, the perseverance, the talents of the developers in Nigeria, and as well as the rest of the region. And we continue to support them.
Yeah, so let's get started. The first team to present is My Choice. So I'll just let them tell us what they've worked on, the problem they've tried to address over the last 48 hours. Yeah, so round of applause for My Choice.
We've come with a product called My Choice. And My Choice is a web-based contraceptive consultation tool for patients. So a consultation refers to an interaction with a doctor. I'm not patronizing, but if you're techie. So what's the main issue? So you have providers, you have contraception, it's kind of available. But the big issue for this group, evidence shows, the evidence is quite scarce. But the big issue is access, and access because of stigma. So what we're proposing is different. We want to change that middleman. We want to remove that barrier to access. And so we want to give the patient the opportunity to have the clinic come to him. And the format of that is a web-based tool. So either on their phone or via, another form of access, Facebook or on the internet if they have access to a computer, and they can ask their questions. So it's a decision-making tool for them. So I need this, what would you like? But I'll demonstrate further. Is there potential to scale up? Yes. In the family planning world, your service providers who want to offer an enhanced service for your patients, so we can actually expand our patient population. And then outside of family planning, there's a trend for patients to go to diagnostic centers and get, blood tests, to monitor their hypertension, to monitor their diabetes. So really, actually, is there any avenue, is there any scope to include like a simple protocol for patients to manage these conditions? Thank you, Rush, but thank you for your patience.
This is what we're talking on, the issues we're facing with the potential user, our working solution, who we're selling into. Our job now is to invade Auntie Christie's WhatsApp and Facebook space with the correct information. This health information, unfortunately, it's not opinion-based. It's not someone's opinion on what something is. It's you're either living healthy or you're not living healthy. So that is what we're doing. So our target audience is young, old, semi-educated mobile phone users between the ages of 15 and 65 who understand how to use basic social media platforms.
Help me understand what the user journey would look like. I really could not see it.
So the user journey is quite simple. Every day we have we only demo our Facebook page, but you can also search for us on Instagram, YouTube, and Twitter. Now on Instagram, with the live story feature, after our story, which will be our skit, you'll see a link to a URL, a link to our site. Then another thing I want to point out is that on our site, before you are redirected here, we are taking so much care about the way we present this information, because we know there are competitions like Dr. WebMD and the rest. So how are we different from WebMD? Apart from the fact that we are a local-based content, we give them infotainment. That's where we tagged it. We are giving them information, and at the same time we are not making it boring. So we have cartoons on our site. We have our cartoons. So those cartoons create engagement.
This is an emergency ambulance service. We've tried to keep the service very simple, and essentially is an app and that you have on your phone. We also have an option of having a responsive web app instead of a full app. But for this purpose of this presentation, we've just developed a prototype based on an app. We're targeting mid to high income earners. We started off thinking we could do a solution that will reach everybody in Nigeria, and we realized that we won't last a week if we did that. So we said, let's start with the high income earners. So we developed a solution for people who can afford it to be able to get an ambulance in under 10 minutes. So that's our objective. So what's the value proposition? For the user, convenient, fast, seamless. For the partners, and these are our partners are the people that will actually provide the service. They will maximize the use of their assets, and they will also generate income from assets they already have, or they can also invest in the business and generate money from it. For us at Swift, you see, we bridge a gap. We empower people that are not currently empowered with that kind of service, and we generate revenue for ourselves.
If the patient dies in the ambulance on the way to hospital, who's responsible?
I mean, remember, we're only providing a platform.
Yeah.
So the part of the signing up is that the ambulance will sign that they will carry the person safely. We can't.
Our solution is an open source USSD, SMS, and web-based enrollment and then payment platform. The payment platform is in small letters because we're focusing on the enrollment for now. And if you understand that in Nigeria, the health insurance coverage is less than 1.2%. The NHIS Executive Secretary said that a few days ago. And for us to attain universal health coverage, which is assessing the healthcare you need when you need it without financial risk, there has to be coverage for everyone. In this same period that we've had our own NHIS, Rwanda has gone up to 85%, Ghana has gone up to over 65%. And one of the things they leveraged on were things like this. Who are our direct targets? Our direct targets are the health insurance providers. This is a product we're developing, a B2B product, business-to-business product for the health insurance to be able to expand their coverage.
We developed a website, and on this web platform, the mother or a nurse can come, register her, ask for her name, phone number, and her location. And immediately she's registered on the platform, she gets a text message that tells her we are going to provide personalized immunization schedule for the baby. Part of what we'll ask for is the date of birth of the baby. And so we prepare personalized immunization schedule and be reminding her as to when and where around the location she registered, she can go register her baby.
Another component of the expansion for baby care is to partner with organizations, international and local. The idea that many of the international NGOs are functioning on right now is data collection. And it's not just international NGOs, it's organizations across the board. So currently, we're looking into a collaboration with one NGO already set in Nigeria, located in about 5 hospitals throughout Nigeria, including in Zaria right now.
Just knowing that they can just walk into somewhere or pay someone to walk into somewhere, having to enter that information and ask questions about that information, there's a sense of stigma around it. Even with this, they still, because they feel like somebody's still gonna get that information or someone. So I just feel like there's a lot to be done there, and from a cultural.
Yeah, so.
Like a Maryland test or something.
At first, don't you face your one? It is face. So even when it's fake, us giving the money doesn't help us.
Our chances of winning is very high. I'm very optimistic. I will say 9. I don't want to say a perfect 10, just in case there's a mistake somewhere, but let's say 9, just to be humble about it.
On a scale of 1 to 10, I think the likelihood of us winning is a 7.
On a scale of 1 to 10, my team is definitely a 10.
On a scale of 1 to 10, I would say it's 9.
We will definitely win this challenge. We're 22 out of 10.
Yes, we're working to win. We are going to win.
Any of the ideas could have been, with the winner, because actually they are all, in our view, quite viable. In position 3, we have Better Medic. So the first place goes to Swift Easy.
Awesome winning the Health Myth Tech Hackathon over the weekend. My team came first.
For the guys who won, that's for Swift EC, and Baby Care. Their offerings were very clear. That technology and was very simple. So it was a bit clearer for them. But for the guys who came 3rd and 4th, we had to struggle a bit to decide. So it was a very close call.
It feels great. Every time you win, it's nice.
I think to a large extent this has been achieved. A few more things may, perhaps be considered, which would, again, like I did ask them today, what is the next step? So it's not just about the hackathon, but what is most important is what is the next step after today.
At this point, the winning ideas are very rough. Even given from the feedback that the judges have given to the different participants.
I think everybody here who built something, I think they were really, they picked a specific problem that is a significant problem. So already know that there's a market for the idea, for all of the ideas.
We are better medic. We came third, but actually we felt like we came first because everybody here, we've been networking so much, and everyone is excited to work with us. So we received the most criticism during our presentation. Was messy. We were pessimistic. When they called the 5th position, we were not the ones. We were already excited, and then 4th, we were not the ones, and then 3rd. It was really amazing.
So the incubation period is the time where we then fine-tune the products. They get into the room with people from my own team, the product development team, and then hash out what is the product that we're trying to build, what technologies do we need, what human elements do we need, who are the people we're going to be building this for, can we get them in the room and have different conversations and make sure that this idea that we're even pushing is one that they will want to access.
Every single idea, the 5 ideas that were pitched today were all like great ideas. They were fulfilling an actual need in the health ecosystem, and it was a great example of how technology can actually play a role, right? So even those who did not win, if they still press on with their ideas, they could go on to be very, very successful. And really, at the end of the day, I think it was a success, particularly because every single solution was a collaboration between technical experts and health experts. So really exciting.
So I think the ideas are viable, yes, but let's see how they get into or what they do when they get into the execution phase.
So the next 3 months is to answer those questions for the individual teams, and then for them to build out a product that is in some ways bug-free, they can push out to the market, and then start, promotional campaigns to get people to use it, and of course give you feedback and iterate on that process.
Well, as they say, they're going to communicate to us some of the steps. But ultimately, we just had a meeting with the team, and I've told the team that it's still only a dream. We won this battle, but there's a war to win. So we're going to take some time out and then think about it.
Well, there's a running joke. They say mixed babies are the most beautiful babies ever, but it's true. There's a beauty when 2 separate entities come together to work together, and one of the greatest part of the teams, if you look at the different teams, they had all sorts of people from all walks of life.
But now the real life is going to set in, and we'll walk through that a few weeks. Then we'll get together. Then we'll go back into serious mode. Then we'll take this idea, which everybody has obviously loved, and we'll make sure we take it to market so that Nigeria benefits from it, and we can leave a legacy that will solve one of the health challenges using technology, which is the whole point of health tech.
On behalf of all the partners, EpiAFRIC, Digital Health Nigeria, Nigeria Health Watch, Co-Creation Hub, and Facebook, I would like to say thank you to all of you for all the hard work you've put in. So at this point, I'd just like to say thank you very much. We'll keep in touch. We've got the mailing list. We'll be sending out material. Co-Creation Hub will be working and Digital Health Nigeria with the winning teams. But do reach out. Hopefully we're beginning to create a health and tech community, a health and tech family where we can begin to share each other's ideas and perspectives. Thank you very much.